Thank you, Presiding Officer. How many warnings from the front line of our NHS will it take for this Health Secretary not just to listen, but to act? Primary care is at breaking point. Members today have laid bare the facts that there simply isn't the capacity to meet demand. Sadly, Graham Simpson highlighted the fact that under the SNP that we now have a national have-not service. Jeremy Balfour outlined the alarming stats and bleak picture. Dr Sandesh Gulhani highlighted the lack of trust in Hamza Yusuf and shed light on conversations taking place behind government closed doors. Jackie Bailey stated that GPs are on their knees, and as Hamza Yusuf says, go to the GP rather than A&E. And what does Hamza Yusuf do? He deflects and he blames Labour, and he makes personal attacks on Jackie Bailey, and he sneers at Dr Sandesh Gulhani. Alex Cole-Hamilton says that it's a slap in the face to GP practices and the heroic healthcare staff. And Paul O'Kane talks about GPs being at their wits' end. And research by the British Medical Association clearly shows that it's not just some practices that are struggling, it's the vast majority. And if primary care buckles, it will be catastrophic, not just for general practice and patients, but for the whole healthcare system. There are two overriding issues affecting primary care: a lack of GPs and a lack of resources. Bob Doris raised Hamza Yusuf's plan to recruit 800 additional GPs by 2027. But the BMA says we don't need 800 additional GPs, we need 1,000. And we don't need them by 2027, we need them now. We also need to stop the hemorrhaging. We also need to stop the hemorrhaging of existing GPs.
Bob Doris, would you resume your seat? She's obviously not taking intervention. Tess White.
In search of better conditions abroad, early retirement, or those who are considering cutting the sessions they currently work. And Mr Doris talks about blame. He's blaming Brexit for these dire situations. You cannot plug the gaps when the system is a sieve. More than a third of practices report having at least one vacancy, which is higher than this time last year. It takes years to train a doctor. The SNP government must focus on retaining the talent we have. Hamza Yusuf says, judge me by my record. On resources, the £65 million cut from the primary care budget and £5 million in support payments means GP practices will have to try to meet patient demand with even fewer resources than before. And the kicker? The £65 million slashed from primary care was announced on the same day the Crown Office confirmed that almost £51 million of taxpayers' money has been spent on the Rangers' malicious prosecution. If the Health Secretary left his bunker and his spin doctors and listened to our doctors and nurses on the NHS frontline, he would understand that establishing multidisciplinary teams in primary care is vital for us to scale up our patient care. And we know there are problems putting multidisciplinary teams in place which can help to spread the GP workload. Presiding Officer, we have an NHS recovery plan which has seen things get worse, not better. We have a winter resilience plan which is telling the public to only access urgent care if the situation is life-threatening, piling even more pressure on primary care. And things are so dire that NHS leaders have considered introducing a two-tier system for treatment which would charge the wealthy.
You need to conclude.
Hamza Yusuf, thank you, Presiding Officer. Hamza Yusuf must step aside and let someone else step up who has the confidence of the medical profession. Thank you.
Ms White.